I'm Dr. Bradshaw, physician, surgeon, and lawyer, and my educational background is not only as a lawyer but also as a physician, but that includes specialized training in obstetrics, and that's one of the areas I work in is obstetrical injuries that have resulted in unfortunately harm to babies as they're being born. Upon graduating high school, I went right into medical school, and from there, after graduating medical school, I trained in surgery for a while, but decided there were some other things I wanted to do with my life, and I went to law school. And I had the good fortune after graduating law school of being able to train with Jerry Spence, maybe one of, if not the best trial lawyer to have ever lived. And after that, I worked with a lawyer who did a lot of medical malpractice work. And some of his cases involved injuries to children during the birth process. And that caused me to become more interested in those type of cases. And that resulted in me then going to Harvard Medical School to a continuing education seminar where I became acquaintances with the chief of obstetrics at Brigham's and Women's, which was really one of the crown jewels of Harvard's teaching hospitals. And from there I started working more and more in these birth injury type cases, helping families who've got children who've been unfortunately injured by these traumas during delivery. There's one case that I always remember, one of the earlier cases I handled when I started my own practice, and that was a young girl who had a catastrophic brain injury. She was still able to function some, but very disabled. And her mother had been to several lawyers and they told her that she didn't have a case. And once I looked at the file, I thought that she did have a case, and I was able to pick up on the fetal heart tracing and the medical records where things weren't done correctly. We eventually got a confidential settlement for her that set up a trust that would take care of that child for that child's life. So she'd have additional money. It wasn't money to pay for everything, but it was money to certainly help out that child and make her life a little bit better. And I was very happy to be able to do that. We want people who've had something like this happen in their lives to feel comfortable in talking with us. I know that speaking with a lawyer can be intimidating at points in time, but we hope it's not going to be intimidating to reach with us. We have a really good support staff. We have an intake person that we'll talk with that will just get some basic information that would be forwarded on to Rich and to Guy, to their law firm, and eventually to me as well if it seems like it's something that we could help them with. And really, we'll do all the work for them. We want them to just take care of their child and not have to worry about this aspect of what's going on.